The AquaCool devices from Aqueduct have really revolutionized my practice. The products heretofore that have been available to cool patients after surgery have been ice packs or freezing water circulating through some archaic type of equipment that you could never control the temperature, very unwieldy. This is a simple, very elegant design that works reliably and has made a huge change for my patients. Prior to having your product, I would have patients use frozen peas. The common response was, "I'll never eat peas again," which would be a frozen product that then dropped temperature from 0 degrees to 40 degrees over a period of a few hours, and was not very effective. And then we would tell patients things like 20 minutes on, 20 minutes off, because we really didn't know how much cooling was good, how long cooling was good. This has brought some small amount of science, some small amount of control, well, a lot of control to the whole process of cooling, and it has made a big difference. When these patients come to us, this is a huge undertaking. This isn't getting a hernia repair. They're not going in to have a repair of some malfunctioning part of their body. This is a life-altering event for them, whether it's facial surgery, rejuvenation, breast surgery, whatever it is. They expect that this is going to be a major change in their lives. They've allotted a certain amount of time, they've allotted a certain amount of money, and they are putting their lives in your hands. They're expecting that you're going to do everything possible to make it a good outcome. We're able to control our surgical expertise. We're able to control our environment as much as possible with the people we hire that are around the patients. We try to make it a really smooth process, getting them enrolled in a surgical program, then doing the surgery, and then post-operatively, it's usually been write a prescription, frozen peas. That's not enough. They need to feel that the post-operative care has been as well thought out and as controlled as the intraoperative part. And Aqueduct makes that possible. There's not a lot of science about cooling and improving wound healing that I've read, but we know that there is a certain amount of kinins that are released during the traumatic process of doing surgery. And even with minimizing our trauma as much as possible, there is a certain amount of postoperative pain that must be endured. And that can be reduced by reducing inflammation. And inflammation can be reduced by cooling and by minimizing edema. And that's where this product has been so useful. Ecchymosis is blood in the tissues. Blood is an irritant. Blood is painful. If you injure yourself, you'll notice that you're sore wherever the bruise spreads, even though it's beyond the area of your original injury. Wherever the blood has dissected, it's painful. The more we can control ecchymosis, the less pain patients will have. The breast augmentation, typically done with a saline device placed under the muscle, can be a painful procedure. We try to do preemptive anesthesia with regional blocks prior to the procedure, either paravertebral or rib blocks. That's been very successful. And then post-operatively, after the blocks wear off, we would tell the patients, ice the chest. Well, sometimes they did, sometimes they didn't. And then they would tell us it was uncomfortable. And trying to keep ice bags positioned around the breasts is the difficult process. The AquaVest has made all of that simple. The bladders that fill with cool water all around the breast but still spare the nipple areola area has been very well accepted by patients. It appears that they're requiring less pain medication. For patients undergoing breast lift, those patients don't have as much pain typically, and this just makes it absolutely smooth sailing for them. They'll say they never had a moment's pain after the surgery. That's remarkable. And less swelling, less bruising, all of that makes a difference. When you're doing surgery, regardless of the instruments that you're using, whether choose to use so-called cold steel or cautery, or some people using the harmonic scalpel with the radio frequency device, there are a lot of different ways to handle tissue, and some are more traumatic than others. Whatever way that the surgeon has found that suits his or her style, that works well in their hands, once they're done with the surgery, they've given up control of the wound healing process. When you apply the AquaCool devices, you're adding some control that goes beyond the last suture. I'd have to say, of all of the benefits of AquaCool, which we've talked about, the decreased swelling, the decreased ecchymosis, the feeling of comfort that it gives the patient, is the decreased pain. It undoubtedly has reduced our need for pain management. I have used pain pumps, and they are still an integral part of my abdominoplasty practice because there is no alternative. But for breasts, I found pain pumps were somewhat unreliable and didn't afford the relief that I expected. The AquaVest has been consistently successful in reducing patients' post-operative pain.